I'm Deborah Henderson. I'm a patient journalist, and we're at the iwCLL Young Investigators meeting in New York, and I'm joined by my doctor, actually, Dr. Constantine Tam from the Peter MacCallum Centre in Melbourne, and his colleague, Dr. Matthew Davids from Dana-Farber here in New York. So thank you, gentlemen. What I'm interested in talking about with you guys is how you deal with patients like me, the kind of patient who wants to empower themselves with lots of information, probably sometimes gets overwrought by how much information they have, and then how you deal with them from the minute they're diagnosed to address their issues in a way, but try and help them distill that information and collaborate in the decision.
Sure.
How did you deal with it?
Perhaps I'll get started.
Yeah.
So, I mean, I think in this age, there's a lot of information that's publicly available, and understandably, when people get diagnosed with a cancer, they want to find out about as much about the information as possible. So I think the first thing to say is that, there's a number of really good resources out there for patient information that are accurate. But people need to be aware that there's a number of sources where the information is really quite inaccurate, and that is the pitfall of something like the internet, for example, where anyone can publish anything, really. So, at least in Australia, societies like the Leukemia Foundation of Australia or the Cancer Councils have public information that tends to be accurate. Their web links tend to link to places that have reputable and accurate information. So I'm always happy, and in fact, I would always suggest to my patient to learn about the disease as much as they can. I will often point them to the right places to get started. And then I'm always very open about the discussion. So I said, look, when you find something, come back and talk to me, because even for I'm a CLL specialist, so I only see CLL, but even for someone who's a specialist physician or an oncologist, often the CLL specific information can be very hard to digest, not to mention for doctors. So I say, come back to me if you have questions, let's go through those information together, and I can give you my interpretation of the information from a CLL specialist point of view. So I think being open is important, and certainly is, and it's important that you let the patient know that there is a number of different sources, and that you're always happy to work with them with the information to explain to them what the information actually means.
At what point, David, when you give someone their diagnosis, so at what point do you start having that conversation with them about information and about treatment choices? I mean, CLL is one of those diseases where there are lots of options and there are lots of different views on when people should be treated or how they should be treated, and obviously it goes on prognostic markers. But at what point do you start having that conversation on the day that a new patient comes to you?
Right. So, when I see a new patient, one of the first things I try to figure out is how much information do they want to know? And actually, I do see a range of patients. I do have patients who really don't want to get into the weeds of the literature, and they just want to sort of know the big picture, but they don't want the level of detail that other patients do. So I try to be very flexible and provide patients really what they want. And most of my patients, I would say, do want more information rather than less, and start to look on the internet. So I also have that discussion kind of early on about making sure you stay with the right websites. For example, there are some chat groups that are around that can be a good resource in some sense, but also there's a bias in terms of who's writing in, and often people are talking about negative experiences, and people don't realize that there are positive experiences also if you're only looking at those chat groups. So we also have a number of great online resources. Another one is the CLL Society, led by Brian Kaufman, who's very helpful in informing patients about some of the nuances of what's developing in the field. As to the discussion of treatment, it's not something I typically have on the first day, largely because, as you know, patients are often observed for a long period of time in CLL, and in some sense the discussion that day might not be relevant 6 months, 2 years, or 5 years from then. So I try to kind of paint in broad strokes initially, say that we have many effective therapies. We've had chemoimmunotherapy, now we have newer targeted agents that are also highly effective. But I try to not go into too much more detail than that, just based on the first evaluation.
And when you are giving patients bad news, is this something you've learned to do over periods of time, say when they relapse, say after
Yes.
chemotherapy, and you have to break the news that it's come back, and this is, something that we're now going to need to treat. Is this a skill that you had training in? Is it something that you've, learnt over the years as young doctors?
Speaking for myself, I think it's something that we didn't really receive any formal training in. We've had to learn the skill ourselves. I think the first thing to say is that you have to be honest with your patient. If you're not presenting the information in an accurate manner, then you're not really doing anyone a favor. But of course, when you present bad news, the first thing to do is I do ask the patient, there are some concerning things here. How much would you want to know? What sort of details you want? Because as Matt says, some patients just want the broad strokes, and some patient wants the very fine details. And I think it's important that we read our patients and we interact with our patients and we give our patients exactly what they want in the amount that they want.
Yeah, it's emotional intelligence, isn't it? Which
Right.
is something that is a difficult concept for people. In my experience as a patient, I've been overwhelmed with how amazing my doctors have been. I don't know in haematology if this is something that, that's why you're all drawn to CLL, because everyone seems to have the same sort of skill set. Do you think there are enough tools there for patients and for doctors to be able to collaborate together when when a patient comes to you and says, "Oh, I have this information, I've found this drug in somewhere far off." Do you think there's enough resources there for you to have that conversation about what is the best way forward?
I see. So I think most of the well-known drugs or the well-known compounds in development, I think that because we're fairly specialized in the field, so we have a good feel for where they are. Sometimes people do find things which are, to me, a completely left field, and a lot of them are drugs which, compounds in the test tube or in the mouse, which has not been tried in humans. And in those cases, I always look at the data and I say, look, give me time to research and have a look into it. We're lucky in this day and age that most of that information is actually quite public. You can actually find the abstract on a particular compound that's new and unheard of, and evaluate for yourself what stage the compound's at. Matt?
Yeah, I mean, the other challenge I think we face is that I often have patients ask me about nutritional supplementation, herbal remedies, these complementary therapies, which may or may not have activity, and I think that is one area where we do not have a lot of resources in terms of data to guide us. We have some studies on the green tea extract, the polyphenol E, and that's largely it. So patients are often looking for something to do, and certainly I can understand that, but we don't want to recommend something that might actually be harmful. And so it is an area that I think needs more investment in terms of actual prospective research.
And there's a big difference between what happens in the test tube and what happens in the human. So, for example, your own group identified vitamin D deficiency has been very important in actual patients with lymphomas. So I always recommend that patients, if they want to do something, vitamin D I think is something that's very helpful to take. On the other hand, we'll remember the antioxidant story, where antioxidants look great as anti-cancer drugs in the lab, but when we actually tested in patients, it actually increased the risk of lung cancer in a study in patients who smoked. So I think we need to take those information very carefully and evaluate them. I believe that our body have evolved. We need to, probably the best way for us to function is to live the way that we're meant to. So we're meant to grow up eating a lot of a balanced diet, getting lots of exercise, not too much meat, alcohol, sugars, which are the ways that our ancestors have always grown up. And I think that's just you probably won't hurt yourself by living that lifestyle.
Well, gentlemen, thank you so much. Thank you on behalf of all patients. Thank you so much for the work you're doing. I'm optimistic that at some point we will have a cure, and it will be because of people like you working on it. So thank you very much.
Thank you.
Thanks.